This is California Edition. My name is Brad Pomerance. We're in Riverside today, and we are joined by the Riverside County Auditor-Controller. His name is Paul Angulo. He was recently re-elected to a second term. Tough election. How many opponents?
No opponents this time.
No opponents.
Thank you.
So that was good. So you made it out of the June primary scot-free.
Yes, absolutely.
But your name did have to appear on the ballot.
Yes, it did.
Do you know why?
Well, under the government code, these offices must appear, and the people must vote.
Well, we congratulate you on your re-election.
Thank you,
I want to
sir.
speak with you about your office and use it as a metaphor for any office that employs public employees, we'll call it. We know that we're in an era today where public employees they've been turned into scapegoats in a lot of ways.
Right. Yes.
That our state budgets are bloated because of public employees. They get, their pensions are too generous, their benefits are too generous. In that era, I would have thought that you would have a difficult time hiring and retaining. Apparently not, though. What's going on in your office?
Well, one of the things that I try to do is to present to the recruits the value added of being a public service worker. It's not just the salary, it's the environment, it's being able to help people and these intangibles, and I make it clear to them just the value that, of the service. And that's really changed a lot of very highly qualified people that we've been able to get on board.
Right, and when they've come on board, they're staying. As I understand it, you had an attrition rate, a dropout rate, we'll call it, of about 25%.
Yes, sir.
And you're now down to 5%.
Yes, sir.
And what's remarkable to me is that has happened during really the worst of the worst times when it comes to beating up public employees, metaphorically speaking.
Yes, yes.
So how have you been able to kind of calm the troops and keep them on board?
That's a really great question, and I hope there's other leaders in California listening to this interview here. One of the things is modeling the behavior. So I don't ask anybody to do anything that I haven't already done or I'm not willing to do. Okay, I believe in leadership up from the front. Okay, the second thing that we've done is make sure that they're well trained for the mission. So I share with them that corporate integrity, mission integrity is non-negotiable. We have to succeed no matter what. But I'm also interested in them individually. And so I know them by name, I talk with them, I find out what they want in the long term, and I try to help them with that.
At the same time, there was a time, probably when you entered the public sector, where the salary may not have been high or as high as the private sector, but the benefits were much better than the private sector. Those days are behind us, where the salaries, I mean, maybe they've come on, into parity, but it's hard to say. But we know that those outstanding benefit packages that the public sector had been offering in the 20th century, those days are behind us. So how are you recruiting the best and the brightest?
Well, again, it has to do with the intangible value. The working for the community is still a great job. Many of the folks that come on board, they really have this service aspect to them, and I point to that. And I remind them that even in our business in accounting, we impact people's lives. And how fast the money turns over, how fast the money gets to law enforcement, to the children in social services, the family that needs that support. I mean, the mission really matters, and that's what I try to get across to them.
And let's talk about that, because yes, I mean, you hinted at it that, an accountant, boring position, not that important, but we know, especially in public accounting, when you're working for a governmental agency, that these dollars matter. And one of the most important jobs of an auditor-controller is to audit, to make sure that our dollars are being spent wisely. And recently, as an example of one of your audits, you went into the Riverside County Regional Medical Center, which in the Inland Empire is a very significant institution. It takes care of thousands of people. Why don't you tell us what the problem was and what you were able to uncover?
Well, let me be very honest with you, very frank. The hospital at the time I initiated these these monitoring reports was upside down $50 million.
That's a huge number.
Okay. The 450,000 hours of overtime was $50 million.
Oh.
Okay, so I started asking questions and bringing it to the board's attention and also to the constituents, let them know it's their money. So what we're trying to do, because historically audits across the nation are rear-looking.
Right.
So what happened 2 or 3 years ago? We're trying to make a difference and be relevant for the decision makers. And these monitoring reports provide real-time information so that the board can make a good decision.
What's so interesting about audits, though, is that you can present the information, but you don't have the power to have that recommendation enforced. You are simply telling them what
Yes.
you have found. How do you use your bully pulpit, you are an elected official,
Right.
to somehow cajole whomever needs to be persuaded that they need to adopt your recommendation on, for example, overtime?
Right. I believe in the old axiom, the truth shall set us free. So my
Right.
job, okay, I'm not going to browbeat the board,
Right.
but I will present the information in public. And that has a equalizing effect.
Right.
When you have the jury of our peers, the voters, taking a look at hard facts,
Right.
that has an influencing effect.
So what happened in this case, for example? Like you had said, it appeared, at a certain level, the overage was as a result of overtime. So what happened?
Well, what's interesting is that the board took it seriously.
Right.
And they actually instructed to the Hospital Regional Medical Center to take a good look at that. And I'm happy to report that it went from 450,000 hours overtime to under 340,000. So they've cut almost 25% out and they're still working on it.
Improvement.
Absolutely.
But the facts are, overtime in the public sector, that's golden.
Right, right.
Because of collective bargaining, whatever you think about it, overtime's golden, and people are gunning towards overtime. And presumably in the medical field, overtime is necessary. I do not want to suggest otherwise. I mean, these are people's lives. So how do you, I guess, again, you can't enforce your recommendations, but where's the balance? I mean, does 340,000, is that what you said? Does that
It is today.
seem to be appropriate, or is that still too much?
It's still too much, to be honest with you. And what I've proposed is a new timekeeping system. So we can monitor this more in real time out at the hospital by the managers.
Sure.
And so they can make a decision on site, okay? I'm not gonna second guess them. Maybe there was a surgery that needed more time. I understand this. And I understand it's a public service hospital.
Right.
I understand that component. But what I'm saying is that we need to take a closer look because the hospital it's not sustainable for the hospital to be 50 million, 80 or 100 million upside down.
And presumably, with the Affordable Care Act coming online, more people will be insured, more people will be seeking medical care, and I guess arguably they shouldn't be going to county because that's for Medicaid, but then there are more people on Medicaid.
Right.
So they should be going to county.
No, absolutely
You're right.
correct.
Right.
The hospital is set up, the Riverside Regional Medical Center is set up to receive ACA.
Right.
But the issue is now there's increased competition by other independent providers for those tax dollars.
So should that help or hurt the budget of the
Well,
hospital?
we're going to see.
Right.
We're going to see if the hospital can compete with the private providers.
Right.
We're going to have to differentiate ourselves here at the county to get those patients.
What about the spike in those that have signed up for Medicaid? Does that cause more patients to come to the county?
Yes. Yes, it does. And that's one of the problems at the county is that they've had a lot of receivables outstanding in the hundreds of millions of dollars that the state has refused to pay for Medicaid people and prisoners.
But now they
as well.
should pay because more money's coming from the feds.
Yeah, but would.
His name is Paul Angulo. He is the Riverside County Auditor-Controller. My name is Brad Pomerance, and you are watching California Edition.